Good afternoon, everyone. Before I start, I would like to greet all the members of the scientific committee, as well as all of the other participants in this meeting. It is a true honor to have been selected to present this paper, especially among such great professionals. I would also like to present myself and the institution I represent. My name is Marco Pires, and I am speaking from the lovely city of Oporto in Portugal, which you can appreciate on the top left corner picture. I'm a first-year general surgery resident in Centro Hospitalar Universitário do Porto, currently doing a fellowship in the Service of Ambulatory General Surgery. This service is based in SICA, which stands for Centro Integrado de Cirurgia de Ambulatório, and is the biggest ambulatory surgery unit in Portugal. This paper is entitled Laparoscopic Nissen Fundoplication in Ambulatory Surgery, and this presentation will have the following contents: introduction, objectives, methods, results, discussion, and conclusion. So, over the last decades, ambulatory surgery has witnessed one of the fastest growing rates in surgical areas worldwide. As surgical teams gain experience, more complex procedures are being included in ambulatory surgery programs. Gastroesophageal reflux disease, or GERD, is defined by the Montreal Consensus as a condition which develops when the reflux of stomach contents causes troublesome symptoms or complications. Being recognized as a public health concern due to its high worldwide prevalence, GERD treatment has been widely investigated. The current guidelines state that the surgical treatment for GERD should be considered in patients who have failed medical management, the patient decision despite successful medical management, considering quality of life and the need of lifelong medication, complications of GERD, or present with the typical symptoms. In spite of the variety of techniques for anti-reflux surgery, the gold standard surgical approach is the Nissen fundoplication. The laparoscopic approach is preferred over the open alternative. It requires a shorter hospital stay and earlier return to work, with no significant differences in failure rates. Objective. The author's aim is to present the experience of the ambulatory surgery unit of Centro Hospitalar Universitário do Porto in laparoscopic Nissen fundoplication for the treatment of gastroesophageal reflux disease and hiatal hernias. To do so, we did a retrospective observational single-center study from November 2013 until February 2020. This enabled us to increase the size of our sample by 3 patients when compared to our initial abstract, and I apologize beforehand for this late change. The inclusion criteria were patients submitted to laparoscopic Nissen fundoplication for the treatment of gastroesophageal reflux disease and hiatal hernias in our ambulatory surgery unit. This is fulfilling all the criteria for ambulatory surgery. A total of 15 patients were included in this study. The authors analyzed several variables, including gender, risk factors, presence of atypical symptoms, preoperative investigation, age at time of surgery, the need for overnight stay, short and long-term complications, the need for proton pump inhibitor after surgery, and the follow-up. Our results showed a total number of patients of 15, 12 being female and 3 being male. Age at time of surgery varied between 18 and 65 years old. All patients did a preoperative evaluation consisting of a complete blood count, renal function and coagulation profile, esophagogastroduodenoscopy, pH metry, manometry, barium swallow, and also a preoperative anesthesia consultation, which all of them were classified by the American Society of Anesthesiologists as a 2. In terms of hospital stay, 9 patients were managed as a day case, 5 had scheduled overnight stay, and 1 had a non-scheduled overnight stay for pain management. No short-term complications were reported, but regarding late-term complications, 1 patient developed dysphagia 3 months after surgery, 1 patient had recurrence of the hiatal hernia 15 months after surgery, and 1 patient developed an incisional epigastric hernia 3 years after surgery. 6 patients still need proton pump inhibitors for symptomatic control. And in terms of follow-up, only 1 patient was discharged from regular outpatient consultation. In terms of the discussion of our paper, our population's demographic profile is similar to that described in the medical literature. Patients were carefully selected for ambulatory surgery setting, with few comorbidities, making them ASA 2 prior to surgery. The extension of preoperative studies. All patients did esophagogastroduodenoscopy, pH-metry, manometry, and barium swallow. This discussion extends a little beyond the aim of this study, despite being a very interesting topic for another paper, for example. Our center's surgical approach was a total fund application due to the surgical team's decision and belief regarding long-term effectiveness. Continuing, first patients had scheduled overnight stay per protocol only at the beginning of the program. And the low rate of early complications is due to the expertise and experience of our surgical team. What is the true significance of these late complication rates? The sample size is not big enough yet to make any conclusions regarding this topic, and a late-term follow-up will also be required to evaluate these complications. Our study had some limitations, starting by being a single-center study, still with growing experience in this specific surgery, which was performed only in 15 patients yet. We also need a longer follow-up period in order to effectively evaluate late-term complications, as I mentioned above. In conclusion, and based on our results, laparoscopic Nissen fund application is feasible as a day case and may be included in ambulatory surgery programs, provided adequate patient selection criteria are met and that procedure is performed by experienced surgical teams. Thank you, everyone, for your attention. I believe you might have some questions, and I will be happy to discuss them in the appropriate time.